everyone. Thank you for watching the 10 warning signs of suicide. The first warning sign of suicide would be a previous suicide attempt. Previous attempts should be considered the biggest risk factor, which would increase the likelihood that a person would be successful on their next attempt. Sometimes those close to someone who's attempted suicide think the suicidal person may be seeking attention. In some cases, this may be true. However, more importantly, this person is in a situation involving intense pain and requires help and understanding from those around them. Simply put, suicide attempts are a person's last resort to deal with or resolve inner pain and may be a preferred choice over feeling like they are manipulating those close to them during an effort to reach out for help. Number 2, a friend or relative has recently committed suicide. A friend or relative of someone who recently committed suicide may adopt a copycat attitude and follow the deceased person's lead. Often, suicide can persuade a close relative or friend to attempt suicide themselves. Number 3, suicidal threats. When a person talks about suicide, many people think there won't be an attempt, but actually, in most cases, the intention to commit suicide was mentioned prior to committing suicide. Pay close attention to statements such as, life isn't worth living, or I wish I was dead. A preoccupation with death through music, art, or even poetry can be considered strong risk factors for suicide. Number 4, depression. At one time or another, we all get sad. Often, we call this sadness depression. It could last for a relatively short time and doesn't interfere with our jobs, families, or our daily lives. On the other extreme, if the sadness persists for a long period and begins to interfere with your day-to-day functioning, then it's time to seek professional advice. Depression has several symptoms, and rarely do they all occur in one person all at once. Depression may come on slowly from feeling blue to deeper, darker feelings more often. It's hard to believe poor sleep and feeling not worthy are forms of depression. Realistically, don't we all feel these ways, at least sometimes? If you can pay attention to these clues, this sometimes can help you determine how abnormal it is to feel this way for extended amounts of time. And for some of us, intense and enduring feelings of hopelessness and despair that go hand in hand with suicide are far more than we could cope with. Because coping skills are inadequate, the option of suicide becomes increasingly viable, sadly. Number 5, changes in personality or behavior. Someone who is suicidal may have a change in behavior. Changes include, but aren't limited to, withdrawal, not caring about personal hygiene or appearance, violent outbursts, absentee from school or work, performance suffers at school and work. Number 6, an increased use of alcohol and or drugs. Usage of alcohol, illegal and prescription drugs to cope and find relief is common. Inhibitions are lowered as a result of using these substances, which can lead to an increase of risky behavior. Drug and alcohol abuse is often linked to suicide. Number 7, behavioral disturbances. Anger, aggressiveness, theft, impulsivity, isolation, and alcohol and drug abuse can indicate an increased suicide risk. Often, people who are more vulnerable will express their feelings in a destructive manner. Number 8, psychiatric illness. Someone suffering from mental illness, such as schizophrenia, often are hearing voices. These voices can increase the chances of suicide if the voices are telling the person to kill themselves, irregardless of the person's desire to live or die. Number 9, preparation for death. Making a will, saying goodbye to people, apologizing for past wrongdoings, and giving away possessions, especially some of their favorite possessions, are indicators of someone thinking about suicide. Number 10, a sudden lift in spirits. All in a sudden, out of nowhere, that person is feeling great and their spirits are lifted. This is a significant factor. They now feel relieved because their decision is definite. the decision to take their life, resolving all of their pain and unhappiness. You'll notice an increase in energy. Not everyone displays these behaviors, but a large percentage do. Try to get them to talk about their feelings as well as their intended suicide. This could be the difference between them living or succeeding in suicide. Get rid of all of your biases, preconceived notions, and prejudices. If you have intentions of helping, simply lending an ear or a shoulder to cry on can make all the difference in the world. If you are having suicidal thoughts or know someone who is, there is help. You can contact the National Suicide Prevention Hotline by dialing 1-800-273-8255. Or on the web, you can go to www.suicidepreventionlifeline.org. Thank you for watching. Take care.